Your voice, your opinion, your community. Fact TV, free speech, protected.
Hello, and welcome to The Art of Being Human. We're talking about alcoholism, but for another moment or two, I want to get back to marijuana because of this bill that's about to pass, or probably will pass, for marijuana for recreational use. I think that the latest research that I can find about marijuana and the effects of it on the human body is this, and I think you need to know this before you make a decision to use or not use marijuana. If you use marijuana on a regular basis, it's not saying how much you use, it's the fact that you use it on a regular basis, you have much more chance of having a heart attack, many more chances of having a stroke, and of ruining the arterial nature, the vascular nature of the chest area, which makes it hard to treat you if you do have a heart attack or stroke. It leaves more tar in the lungs than a cigarette does, and if you want to think about it is in terms of its safety, it's not safe to take on a regular basis. But neither is alcohol, neither are other drugs as well. So this bill may pass, but you just need to know that what the chances are of having a heart attack or having a stroke. Now, marijuana is not a hard drug, and it's very useful in control of pain, in control of seizures, in a medical sense. But if you are using it recreationally, you need to think about the fact that you well could have a heart attack, you well could have a stroke, you could destroy the vascular system in the chest area, and you need to consider those things before you decide to not use it. It's a case of risk versus benefit. Medically, it's very, very helpful. I would not try to stop anyone from using it if a doctor recommended it medically, but to use it recreationally, you take your chances in having a heart attack or a stroke. So just to bring that up, that bill has not passed yet, but I think it may pass. It's still in the legislature, but I think it may pass. So I just want to give you that information. Heart attack, stroke, and the vascular system all negatively impacted by the use of marijuana. It's almost a case of choose your own poison. If you're going to be drinking, or if you're going to be smoking, or if you're going to use marijuana, there's all kinds of risk involved in that. But people do it because they are looking for a way to feel good with a cheap high. That's what they want. But you know, it's dangerous. Any drug is dangerous. Well, let's get back to alcoholism. Alcohol is a natural substance. It actually is a food because it has sugar, it has calories, but it has no nutritional value. If you drink, then you're not getting any nutritional value out of it. But it is a food because it has calories, and it is called sometimes ethyl alcohol, ETOH. It is a food. There's no nutritional value. I stressed that before. Different alcohol drinks are due to different sources of sugar and fermentation. And so this is what we have. Beer is from sugar and barley. Wine is from grapes and sugar. Rum is from molasses and sugar. Whiskey is from malted grams and sugar. So you have different drinks due to the cause of it. Alcohol depresses the central nervous system. It causes behavior and mood changes, and intoxication is from 0.08 to 0.10. The body burns alcohol at 0.5 ounces an hour. Now, the effects of alcohol will be depending on how much you drink, and that will be, do you have any food in your system? Are you drinking a lot? And also your size and your weight. If a person is stressed or tired, it all makes a difference in terms of how you react to alcohol in your system. Now, half of Americans 12 or older do drink some alcohol, and many people drink to relax or to celebrate for special occasions or something like that. But alcoholism is the third leading cause of preventable death in the United States, the third leading cause. So any drug you take, and it is classed as a drug, any drug you take can have an effect upon your brain, and how much you take affects the brain sometimes seriously. It is the nation's #1 health problem. It strains the healthcare system. It puts a strain on the economy. It harms families. A lot of people just fall apart. They don't have their families. They lose their families because of their drinking behavior. It threatens public safety. It causes 1/4 of all emergency room visits, and it causes 1/3 of all suicides. You know, there are a lot of people who they are caught in a drug situation or an alcohol situation, and they end up by committing suicide because they can't handle it if they don't have it. They have to have it, but it's no longer pleasurable for them to have it. They want to get off from it. They don't want to use it, but they don't have a choice because of the brain changes that occur when you use drugs. And that causes the brain to take over and demand the drugs, and then you can't get off it without help. And then you get suicidal because you can't do that. So it does cause a lot of suicides. 1/2 of the homeless and domestic violence is alcohol related. It contributes to heart disease, to cancer, and to stroke. And fetal alcohol system is the leading cause of retardation, so I've read. And that it affects babies terribly. If a person drinks during pregnancy, it really affects them. Now, there are 4 phases to alcoholism. There's the pre-alcoholic phase, in which alcohol is used in order to relieve stress. And children watch their parents to drink, and they decide it's okay to drink because their parents are doing it, so why not them? And then the tolerance develops as a result of that, and the drinking increases. So you need to watch what you're drinking around your children. Let me review that just one more time before we go to the next phase. Pre-alcoholic phase is when you use alcohol in order to relieve stress. And children learn to use it, or think it's normal to use it because their parents do, so they don't see a problem with it. And a tolerance develops and the drinking increases. Now, the second phase of alcoholism is called the early alcoholic phase. That's when you have blackouts, when you have brief amnesia following drinking. You can't remember what you said, you can't remember what you did, and alcohol is now required. It is now not pleasurable at all, and it has to be required. So you get secret drinking, sneaking drinks, getting alcohol, drinking fast, and feelings of guilt because you're still doing it and you can't get off from it. So what starts as a pleasure ends up as something of a nightmare, and you can't get off from it without help. Now, the crucial phase is the third phase. That's when alcoholics lose control. They're physically dependent. They do binge drinking. They drink at whatever they can. It causes sickness, loss of consciousness, anger, aggression, and living in squalor. That's the third stage. So let me just review that. Alcoholics lose control. They're physically dependent. They binge drink. That means hours to weeks drinking. I've known of people who go to hotels, book a hotel for a week, and do nothing but drink all week. That's all they do. They bring their alcohol with them, and they drink all week. No one disturbs them. No one tells them to stop, and they just drink and drink and drink. But they get sick. They sometimes become unconscious. They have anger and their aggression, and their living standards really goes down to squalor level. It is a total focus to lose everything: family, friends, jobs, careers, anything that's important to you, just to get more drinking. That's the third critical stage. This is where you lose your family, you lose your jobs, you lose your marriage and your friends. Then there's the fourth stage. The fourth stage is the chronic phase, where you have emotional and physical disintegration. You are intoxicated more than you are sober. You feel helpless. There's self-pity, and there's psychosis. Now, psychosis is when you lose contact with reality. and you are like in another world. You have no idea what's going on. What you believe is not right. What you hear, what you see is not right. It is a psychosis, and every system of the body at this stage is starting to shut down. To stop drinking gives terrifying symptoms. If you are at that stage and alcohol has total control of your body, then when you withdraw, you will have terrible symptoms, hallucinations, seeing things that aren't there, tremors, shaking, convulsions, severe agitation and anger, panic, depression, and suicidal ideation. Suicidal ideation is when you think about suicide all the time and you can't get out of it, and you can't get out of that. Now, alcohol's effects on the body. Alcohol depresses the central nervous system. 20% of the dose of alcohol is absorbed immediately into your bloodstream. It doesn't even have to digest. 20% of the drink that you have, alcohol, goes directly into the bloodstream. It goes to the stomach and it's not digested. It is absorbed through the stomach wall into the blood. It does not have to be digested. It goes from stomach to blood and then to brain and slows the brain function. The other 80% is digested through the normal digestive processes. So 20% of all you drink directly into the blood system, and then the rest is going to be digested. It will be digested through the regular digestive system. Now, the moments after alcohol is consumed, it can be found in all tissues of the body. So when you're drinking and the 20% goes into the stomach or goes into the bloodstream immediately, it can be found in all tissues of the body. And at low doses, it's going to produce relaxation, loss of inhibition, lack of concentration, drowsiness, slurred speech, and it disturbs the sleep. That's low dosages. Then when you get chronic use, then you have these conditions. I'm going to have to go over them with you. I'll list them off, but I'm going to have to go over them with you. Peripheral neuropathy, you're not going to remember this, but I'll read it off anyway. Peripheral neuropathy, alcoholic myopathy, Wernicke's encephalopathy, Korsakoff psychosis, alcoholic cardiomyopathy, esophagitis, gastritis, pancreatitis, and alcoholic hepatitis, and cirrhosis of the liver. That's quite a list. If you get to be drinking that much, you may have not all of these, but these are the results that you could have. So I think what I'm going to do is close here, because I have to go through this list one by one for you to understand what it is and what it does to your system. So I'll close off here, and we'll continue with this next time. Thank you for watching. Please join me again.